Welcome to Mayo Medical Laboratories Hot Topics. These presentations provide short discussion of current topics and may be helpful to you in your practice. Our speaker for this program is Dr. Glenn Roberts, a professor of laboratory medicine and pathology and microbiology at Mayo Clinic, as well as a consultant in the Division of Clinical Microbiology. Dr. Roberts discusses disease-causing dimorphic fungi and how to identify them in culture. This presentation examines blastomycosis. Thank you, Dr. Roberts.
Thank you for that introduction, Sarah. I have nothing to disclose. The diseases caused by the dimorphic fungi are histoplasmosis, blastomycosis, coccidioidomycosis, paracoccidioidomycosis, sporotrichosis, and pitocillosis. The dimorphic fungi are different from most of the other fungi that we have talked about and will talk about in that the growth rates are relative. It depends upon the organism. In textbooks, you notice that dimorphic fungi require anywhere from a few weeks to a month or so for growth to appear, and the growth rate is relative. It depends upon how much organism is present in the clinical specimen, and also the culture medium in which it's grown, and probably the metabolism of each individual organism. Blood enrichment actually enhances recovery of these fungi in certain instances, but not always. However, it does decrease sporulation, so it becomes necessary to subculture an organism that is recovered on blood-containing medium to allow it to sporulate. The microscopic morphology shows very small septate hyphae, which is in contrast to most of the fungi that we deal with. And we do have some tools that allow us to identify these organisms besides just the microscopic morphologic features, and that would be nucleic acid probes, nucleic acid sequencing, and MALDI-TOF, a relatively new tool for identification. This image that you see here shows the small hyphae I was talking about that is seen with the dimorphic fungi. It's also seen with some of the dermatophytes like trichophyte and rubrum as well, but more commonly to the dimorphic fungi. The colonial morphologic features of the dimorphic fungi vary depending upon the individual organism and also on the medium that's used for recovery. You can see that several cultures of an organism may appear different on a different media, and so what is necessary is that you become familiar with the morphology of these organisms on different culture media so that you can ensure that you are not going to throw one of these organisms away. The colonies of Histoplasmic capsulatum and Blastomyces are virtually indistinguishable, so the colonial morphology there doesn't really play a role in making an identification. This presentation will focus on Blastomyces dermatitidis, and we will talk about the geographic distribution of where it's found and some of the morphologic features and how we identify the organism. The geographic distribution includes North America, primarily the states that include Ohio, Missouri, and Mississippi River valleys. And the primary states that are where you see it the most often are Kentucky, Missouri, Wisconsin, Iowa, Arkansas, Louisiana, Tennessee, Illinois, and Minnesota. It's also found in Canada in the provinces of Manitoba, Ontario, Alberta, and Quebec. So it's seen primarily in North America. However, it is seen in other parts of the world. It's been reported in Africa, in South America, India, Eastern Europe, Israel, Saudi Arabia, and Mexico, and there's some questions about whether or not those have been actual recoveries or whether they've actually been exposed to the organism within those countries. Sometimes these organisms are transmitted by fomites that have been packed and mailed someplace, so this may be an instance where some of these occurred like that. There have been a number of outbreaks of blastomycosis in North America, primarily in the U.S., and some of them are very interesting. They've occurred in Minnesota and Wisconsin and Illinois primarily. This next image shows you a map that is a rough illustration of where this organism is found in the U.S., and you can see the states that are included within this circle on the diagram. In terms of where we find this organism in the environment, actually is a pretty important thing. When you're taking a history, we talk about where patients have been and what they've been exposed to, but with blastomycosis, it's a little bit different. The ecology of where this organism is in the environment has not been well defined. It has been recovered from several soil samples, but not repeatedly. And we know that there's some association with soil, wood, and areas near water, like in the north woods of Minnesota and Wisconsin, but it's never been proven that there is one source that is linked to the presence of this organism. One of the questions that's asked during the history and physical examination is what kind of activities have you been doing? And any activity associated with aerosolization of this organism from soil or wood is probably where it's acquired, but again, it's unknown at this point. This diagram shows you what we think happens in the environment. You'll start on the left-hand side where you see on the bottom right above the word blastomycosis. You see the hyphae that have kind of broken down into arthrochonidia, and you see a few small spores or conidia. Those are found, again, somewhere in the area where there's wood and where there's water. And whether or not it's an animal or a human, this organism is probably aerosolized from the soil, and it's inhaled and taken down into the lungs, down into the alveoli of the lungs, the conidia are, or even the small portions of the hyphae. And what happens within the lung, you see in that little square box there in the lung, in the left lung, is that the organism, whether it's a hyphofragment or whether it is a conidium, begins to convert into a budding yeast cell, a large budding yeast cell, much larger than what entered the lung, up to 8 to 15 microns in size. And once that happens, the organism then begins to replicate within the lung, and the cycle starts all over again. And what we recover in the laboratory is this yeast form that is recovered from the patient. And this is where we get the term dimorphic fungi, because it has two forms. It has a form that's found out in the environment at 25 to 30 degrees centigrade, referring to the hyphoform you see on the left-hand side of the slide, or a yeast form that is found within the host or incubation at 35 to 37 degrees centigrade. In terms of the pathogenesis, we've kind of touched on that already, but it's acquired by inhalation. We know that it occurs by that because most of the infections are pulmonary in origin. However, dissemination does occur as a result of hematogenous spread, and for years we've thought this happened and never been proven. And we ended up seeing a case some years ago, a lady from Iowa who ended up having disseminated disease. She had never left the state of Iowa for travel, and her only history of exposure was that she was digging in her garden. And we figured that she probably ended up getting pulmonary infection, because if you had seen the x-rays of the lungs, you would see why I say that. And within a very short time, she disseminated. This is an example of the kind of environment that we have seen blastomyces infect people after being exposed to this environment. It's where you see wood and water. Whether it's decaying wood, I have no idea. What the water has to do with it, I have no idea about that either. But this happened in Minnesota, where two fishermen ended up fishing in the same place and didn't even know each other, and they both came down with blastomycosis, had been in the very same place, and walked through all these areas here, and so it had to be in that environment. In terms of what do we culture and what do we submit for direct microscopic examination? Well, we know the lower respiratory tract is involved because pneumonia is a feature of blastomycosis. This organism causes disease of the long bones like the femur. One of the manifestations of disseminated disease is skin lesions, production of skin lesions, and lesions in the mucous membranes, sometimes even overlooked by people whenever the patients wear dentures and the dentures are not removed. Oftentimes you can remove those dentures and you will see ulcerative lesions that look like carcinoma, and then these turn out to be blastomycosis. Prostate in males is also a site where you can find blastomycosis, and also cerebrospinal fluid. When meningitis is not necessarily a major clinical presentation when in the nervous system, but it has to do more with brain lesions, brain abscess. And these are substantial infections, and the patients don't do well even on therapy. The direct microscopic examination may provide the earliest signs of diagnosis, and most of the time you can actually make a definitive diagnosis because this organism is large enough to be seen under the microscope. It's 8 to 15 microns. It has broad-based budding yeast cells on it. and we think about the three B's, the broad-based buds that we see under the microscope in sputum, or sometimes from skin lesions, even from brain lesions. This is an organism that is fairly easy to recognize. There is an exception to this, and that is that there are some cells of Blastomyces that are around 2 microns in size. It's called the small form Blastomyces Dermatitidis. And this one is not so easy to recognize and oftentimes is confused with Cryptococcus neoformis, but that's not the rule, that's the exception. This is a potassium hydroxide calcifer white preparation showing Blastomyces dermatitidis in sputum. You can see the two cells touching each other, and that area where they touch is kind of representative of the broad-based bud. Sometimes it's even a bit more obvious than in this one. A gram stain oftentimes is helpful in making a diagnosis of blastomycosis because the organism is large enough to be seen easily, and you can see in the center here, you can see the two cells touching each other, and there is a broad-based connection between the two cells. In terms of the histopathology, this disease, it presents differently in terms of tissue response compared to all the other dimorphic fungi. This one causes a suppurative response, and that is it forms abscesses with a large number of neutrophils present, and that's most often seen. Sometimes you can see granulomas as well, but it's not that common. Most of the time it's an abscess. This is an example of microabscess formation in tissue. And if you look, you can see the walls of those abscesses, and they actually are filled with neutrophils. And if you look closely in the one about 4 o'clock, you'll see that there are some round cells in there, and those are the cells of Blastomyces. And the other cells are all neutrophils. This is an example of what Blastomyces dermatitidis will look like in lung tissue. These are cells that have another feature that we did not talk about, and that is a double contoured wall. These cells appear to have the cytoplasm shrink away from the cell wall, and when that happens, it gives the appearance of a double contoured wall. The two cells together at about 9 o'clock show you a typical broad-based bud of Blastomyces dermatitidis. This is a colony of Blastomyces, and it's nothing more than a fuzzy white colony. It could be just about anything. The growth rate is in textbook says it takes up to maybe 4 or 5 weeks for this to grow. The lady I mentioned a minute ago that was from Iowa ended up having Blastomyces recover from the blood in 2 days. And if you'd seen the amount of organisms in those blood cultures, you would see why it just took 2 days. So it's all relative to the things that we talked about earlier. There's no set time on these things, and they don't all grow slowly. This is another colony of Blastomyces. These actually look like colonies of Histoplasma too, so you can't tell them apart. This is a colony that is a bit bigger and probably took longer to grow. This is one where you see the colony appears to be almost yeast-like. It's very flat. It's not fluffy at all. It's more adherent to the agar. It looks almost dried. Sometimes some of these colonies look a little bit like dermatophytes. This is one where it looks almost like a yeast colony on a blood-containing medium. But if you look closely, you notice that there are little tufts of hyphae sticking up in the center of some of those colonies. And this is what some of the dimorphic fungi look like on a blood-containing medium. Not just Blastomyces, but it can be Histoplasma as well, and maybe even coccidioides. So this image here shows you 3 different culture media, having the same specimen inoculated and the same amount to each plate. If you look at the one on the left-hand side, upper, about 10 o'clock, you notice it is that same type of colony we just talked about that's sort of glabrous, almost yeast-like. The one down at about 6 o'clock is white and fluffy, and the one that you see at about 2 o'clock is another one that looks almost yeast-like with those hyphae sticking up in tufts. This is the same amount of specimen of the same culture on 3 different media, and you need to become familiar with what these things look like on different culture media because they do appear to be different, as you can see. This glabrous colony shows you one that is not fluffy and is very adherent to the agar. It appears to have some embedding into the agar surface actually when you look at it. This is an example of what a dimorphic fungus might look like among a bunch of yeast colonies. And all the white colonies you see that are small and kind of shiny, Those are all yeast colonies, probably of Candida albicans. The colony at about maybe 7 o'clock that is white and fluffy is Blastomyces dermatitidis, sitting around those colonies of yeast cells. This is an example of what would happen if you took a colony of a mold form of Blastomyces dermatitidis and you put it at 35 to 37 degrees centigrade and incubated it at that temperature for a few days. It would convert from the mold form to the yeast form. And this is what the yeast form looks like. It's waxy, it's kind of sometimes heaped up and very wrinkled. It's not something that we do these days all that often because we have new tools that we can use to identify the organism, but some people still do this because it's cheaper. This slide here shows you an example of what Blastomyces might look like growing on a blood-containing medium. And all the colonies are Blastomyces except the one about maybe 8 o'clock towards the center where you can see it has a very smooth circumference and it's not kind of fuzzy around the edge like you see with the rest of them. This is an example here of Blastomyces present in the amount that you can hardly conceive in a specimen from a patient who has blastomycosis. This is confluent growth of Blastomyces, and this patient had to become very ill having to have this amount of organism in the clinical specimen. This is from the sputum. What would we be looking for under the microscope if we looked at a colony of Blastomyces? What will we be looking for? It's not necessarily what we're going to find every time, but it's what we'd be looking for. Be looking for small, delicate septated hyphae that we talked about. We would be looking for, in this case, spherical to pear-shaped or pyriform-shaped conidia produced at the tips of long or short conidiophores. And some people refer to these conidia as looking like lollipops. The conidia sometimes can be confused by some people with Scedosporium apiospermum or with Trichophyton rubrum. And there's been a name change for Scedosporium apiospermum, and we'll talk about that in another series, but we're going to continue to use this name because of the familiarity with it. The colonies, again, look like histoplasma. This image shows you the conidia. Those are the pear-shaped or round cells that you see all in this image, and they're attached to a long stalk or a short stalk that is attached then to a hyphal strand in the culture. It's these small spores that probably get down into the alveoli of the lung and cause active disease. It's also the breakdown of these tiny hyphae into smaller pieces that probably are aerosol as well and inhaled by the person and then acquires blastomycosis. If you were to look at this image, do you think it would be possible to distinguish Blastomyces dermatitidis from Histoplasma capsulatum? Histoplasma capsulatum has two types of spores, and we'll get to that. They have macroconidia that are rough and wart-like and very large. Then we have conidia like this that are small and almost look like Blastomyces. In fact, they look like Blastomyces. You could not tell these two apart by looking at this image because you'd have to look at the whole slide and make sure that you didn't happen to find one of the larger spores of Histoplasma capsulatum before you decided to put a name on it. And then you still might miss the identification because it might not produce those large spores in the area where you looked. Blastomyces dermatitidis in the past has been converted to its yeast form on a medium called cottonseed agar that was incubated at 35 to 37 degrees centigrade. And what happens is the mold form actually begins to, the hyphae begin to enlarge and in time form these large budding yeast cells that are 8 to 15 microns in size that have those broad bases on them. And some of the cells we mentioned earlier may be 2 microns in size. But with the yeast colonies we saw a while ago, it's heaped up and wrinkled and waxy in appearance. This is another example here of the yeast form of Blastomyces in a large tube, and you can see the colonies are kind of heaped up and appear to be a little bit waxy. And this is the beginning of a conversion from the mold form to the yeast form. In the background are the hyphae that this thing started with, very small hyphae. And if you look at it see, over a period of days, what you would see would be the production of some round cells that are large. And in time you would find some that begin to bud. The next slide shows you the beginning of budding cells, and you can see they don't exactly look like round cells of blastomyces, but they do have that double contoured wall, and they have a space between them and a flat base between them. If you look at the one about maybe 530, kind of at an angle, you'll see that it has a cell and a broad base. Starting at the top, there's a bigger cell, then there's this flat base, and there's a smaller bud connected to it. That one looks pretty good for blastomyces, but it doesn't have the double contoured wall. So what you do is you look around for everything and try to make sure you find some that are as typical as you can find. You don't always find them. This is a better example of what happens with time. These cells begin to convert further, and they begin to form cells that are round and have this double contoured wall. And on here I don't see any with broad-based buds that are very good yet. But the next one shows you further development of these yeast cells. And if you look around in there, you can see some that have broad-based buds on them, and they have a double contoured wall. And this is what Blastomyces dermatitidis looks like. This next image shows you what ideally they would look like. This is what is a textbook perfect picture of this organism. You don't always find them looking this way.